Today, we're reviewing the clinical components of functional mobility and how we, as occupational therapy practitioners, analyze, cue, and intervene to maximize patient safety, independence, and occupational performance. EO1. Bed mobility. Bed mobility encompasses all movement within the bed, rolling, bridging, scooting, repositioning, and transitions from supine to sit. As practitioners, observe how the patient uses, or fails to use, momentum, sequencing, and leverage. Assess ability to move to the left and right sides, noting differences in strength and motor control between strong-weak sides or right-left hemibodies. Cue motor planning. Reach across your body. Press through your forearm, or use your legs to assist the roll. Bed mobility is foundational to reducing caregiver burden, reducing skin breakdown risk, and preparing for safe transfers. 2. Transfers include sit to stand to sit, stand pivot, squat pivot, slide board, and mechanical lift transfers. Practitioners must determine the safest transfer type based on the patient's strength, tone, coordination, balance, and cognition. Evaluate ability to transfer to SOC from bed, chair, wheelchair, toilet, shower chair, tub bench, and car. Prioritize safety through gait belts, correct hand placement, and environmental setup. Use step-by-step verbal cues to facilitate motor learning. 3. Ambulation and wheelchair, mobility, ambulation. During functional ambulation training, assess gait mechanics, endurance, device management, turning ability, obstacle negotiation, curbs, slopes, and uneven surfaces. Integrate these tasks into meaningful occupational contexts, such as walking to the bathroom, kitchen, or mailbox. Wheelchair mobility. Evaluate brake use, footrest management, propulsion mechanics, maneuvering in confined spaces, door management, and safe navigation of ramps or thresholds. Consider whether the wheelchair type, manual versus power versus scooter, aligns with the patient's functional abilities. 4. Reaching and object transport. Reaching tasks, forward, lateral, overhead, and to the floor, should be performed from both sitting and standing. This gives insight into postural control, balance strategies, and safety risk. Carrying objects while mobilizing reveals functional endurance, dual task tolerance, and real-world safety, essential for home and community re-engagement. 5. Identifying impairments that influence mobility. When documenting functional limitations, consider strength deficits, abnormal tone, sensory loss, coordination deficits, limited ROM, poor activity tolerance, impaired balance, pain, dyspnea, and cognitive or visual perceptual issues. These impairments directly influence mobility and must be linked to safety, independence, and medical necessity in your documentation. 6. OT intervention. Interventions fall into 3 major categories: remediation, compensation, and adaptation. Remediation, strengthening, balance training, endurance training, motor control and coordination retraining, sensory re-education compensation, one-handed, hemiparesis strategies, task segmentation, and step-by-step sequencing energy conservation, cognitive and perceptual. Strategies, adaptation, environmental modification, walker, wheelchair, transfer board, gait belt, bed, rail shower chair, toilet riser, lift equipment, ramps, stair glides, doorway, widening bed or chair height. Modification match intervention choice to the patient's underlying deficits. Safety level and home environment. 7. Task modification and clinical reasoning. When a patient cannot complete a task safely, modify it. Functional mobility is one of the most essential parts of taking care of ourselves. It's how we move from one position or place to another during everyday activities. Whether it's rolling in bed, standing up from a chair, transferring in and out of the tub, or moving with a wheelchair, these movements form the foundation of independence. According to the American Occupational Therapy Association, functional mobility includes activities like in-bed mobility, wheelchair mobility, transfers between surfaces, and even functional ambulation, which is walking during daily routines. It also involves transporting objects, like carrying your toothbrush from the counter to the sink. Think about your morning routine. Did everything happen in one place? Probably not. You moved from the bed into the bathroom, stepped into the shower, sat down to get dressed, maybe reached down to pick something up from the floor. Every one of those movements is functional mobility. Moving around in our environment is essential to taking care of ourselves. Without functional mobility, even simple self-care tasks, like bathing, dressing, or using the restroom, can become extremely difficult or unsafe. In occupational therapy, our goal is to help people move safely and confidently within their daily occupations, not just to walk, but to function. That may include learning how to transfer in and out the car, stepping in and out of the bathtub, sitting up in bed, or standing with support. Functional mobility includes several key areas. Let's take a closer look. Bed mobility, moving side to side in bed, rolling onto your side or sitting up in bed. Transfers, sit pivot transfers, stand pivot transfers, getting up or down from the floor, sitting down after hip surgery, transferring in and out of bathtub or shower, transferring in and out of a car, and sitting on the toilet wheelchair mobility, maneuvering a wheelchair safely from one place to another. Each of these skills helps a person maintain independence and reduces the chance of falls or injuries. As occupational therapists, we teach patients and caregivers how to perform these movements safely. We guide proper body mechanics, demonstrate safe transfer techniques, and ensure mobility supports meaningful daily activities. Our mission is simple: empower people to participate fully in the activities that matter most to them. Functional mobility is not just movement, it's freedom, dignity, and the ability to care for oneself. With the right guidance, tools, and education, anyone can learn safer ways to move through their day.